Okay, so you were hurt. Sorry, yaar. Whenever there's some problems going on, and it really disturbed me. Now look at this. Now I will again go to. Oh, this is not good, yaar. Okay, so where I was. Sorry. Okay, this one. Okay, so retention of blood kidney and varying degree of recovery of the heart is a poly period of time. So your heart goes to semi-chronic state. Your stomach because after and as I said in this graph, this D point when it reaches this D point, this compensated recovery stage, it is not achieved in one day or it's achieved in months. So, it's your heart and your body is compensating this reduced blood supply by kidney and by sympathetic nervous system. So it goes to chronic stage. Okay. Okay. So renal retention will increase blood volume occur for hours to days. As I said, is renal retention even if you have acute myocardial infarction, it will lead to what? It will lead to chronic stage with time. Okay. So what your body compensation mechanisms will be? Your body compensation mechanism will be your kidney. So your kidney will do what? It will retain fluid and it will increase blood volume. Why? Because as I said, to increase arterial pressure and to increase what? Cardiac output, because it has decreases with time and it has decreased. So your body will compensate by this. A low cardiac output has a profound. Okay, I will just zoom it. A low cardiac output has a profound effect on renal function, something causing anuria. When the cardiac output passes to 50 to 60% of normal. In general, the urine output remains anuria. Anuria mean no urine. Polio high greater amount of anuria no urine. So even when your cardiac output is decreased, so what's its effect on your kidney? Because anuria mean your urine stop. So it has a very profound effect on your kidney. Okay, so in general the urine output remains below normal as long as the cardiac output and arterial pressure remains less than normal. Urine output usually does not return all the way to normal after an acute heart attack until the cardiac output and arterial rise almost to normal levels. So your urine will be less. You will go to anuria. Anuria mean I cannot pronounce this word. So it goes to this. Okay, and what? Okay, I will erase all these. Moderate fluid retention in cardiac failure can be beneficial, and it's beneficial that your kidney retain the fluid, because to increase arterial pressure, many cardiologists have considered fluid retention to always have a detrimental effect in cardiac failure. However, a moderate increase of blood fluid and blood volume is an important factor in helping to compensate for the diminished pumping ability of the heart by increasing venous return. I hope you guys will understand what I have said to you earlier. The increased blood volume increases venous return in two ways. But first it increases the mean systematic filling pressure, as previously I had, which increases the pressure gradient for causing venous flow of blood toward the. So what causes blood flow? What causes blood flow high? Blood flow is increased by pressure difference. Is one equation in physiology, and it is decreased by what? Resistance. So blood flow is directly proportional to what? It is inversely proportional to resistance. It is in resistance of the blood vessel. It is directly proportional to the what? It is directly proportional to the pressure difference. It is inversely proportional to the resistance. So pressure difference, it increases the pressure difference, and that's why it increases the mean systematic pressure and venous return. Okay. Second, it distends the veins. Why it distends the vein? Because veins have high capacity tense and high compliance, so increase in blood volume have a greater effect on the veins, which reduce the venous resistance and allow even more ease of flow of blood to the heart. If the heart is not too greatly damaged, this increase in return can almost fully compensate for the heart diminished pumping ability. Enough so that even when the heart pumping ability is reduced to as low as 40 to 50% of normal, the increased venous return can often cause nearly normal cardiac output as long as the person remains in a quiet resting state. When a person is resting, so what? This increase in venous return will cause high cardiac output and it will fully compensate your cardiac failure. But when you are in rest, not in exercise, as I said in this graph, you will have high cardiac output, you will have normal cardiac output, but you will have high arterial pressure, and this high arterial pressure is because of this venous return. Due to high venous return, and it's necessary and it's important for what? For cardiac compensation, cardiac failure compensation. Okay, when the heart pumping ability, when the heart pumping capability is reduced, but the blood flow to the kidney panel becomes too low for the kidney to excrete enough salt and water to equal salt and water intake. When the heart pumping ability is reduced, for the blood flow to the kidney panel becomes too low for the kidney to excrete enough salt. You will understand it, but I will okay, I will explain further that if gradually with time, okay, your body is compensating, no problem. You have normal cardiac output at high arterial pressure and at high venous return, at high blood volume. Your kidney is compensating, but if gradually with time your heart pumping ability is decreasing, so it will maintain that same blood flow. No, it will gradually decrease the pumping ability because you have MI and it is goes to severe stage. So your heart your heart will be going weak and your pumping will be less. So this less pumping will cause decrease arterial pressure. Even your body is compensating, but not your body is needing, your heart is going weak. So this decrease in arterial pressure will cause what? Your kidney will not